So obviously in France, we had the reports on hepatitis E by consumption of raw, let's say pork and pig meat, and published this 15 years ago. I don't know what your recommendations are in France and Romania regarding, how to deal with this issue, of the risk of hepatitis E virus infection, by eating pork and other foods which may be contaminated.
We say to them to make attention, of course, but we try not to avoid completely some food, because sometimes they feel like this is like a punition, like they are guilty. So we try to explain them why, but we still have some hepatitis and some problem. And at first we thought that it was just in course, in figatel, in the liver, and then we found it very much. And in Ile-de-France, which means the region of Paris, 24% of patients have a serology positive for hepatitis. So it's very complicated to avoid a lot of foods for them.
In Romania, a lot of persons eat pork, but it's cooked usually, not raw meat. And the prevalence of hepatitis E in Romania is low. So we just, in transplanted patients, just had several that had hepatitis E. So maybe it's not really a concern. But as I said, they do not really eat raw meat.
Yeah, so I think the overall prevalence is probably low of, let's say, acute and chronic hepatitis E, but there are cases, and so our advice is to avoid consumption of raw and even medium raw pig contents may carry the virus, and the virus you have to cook it for at least or heat it for at least 3 minutes above 70 degrees. Then the hepatitis E virus is destroyed. But everything medium raw, etc., may harbor the risk. And in northern Germany, I can tell you, it's if you go to a butcher here close door to Hanover Medical School, the risk that this meat, pig meat, contains infectious hepatitis E virus is 50%.